Welcome, I'm Dr. Keith Moran. You're watching Medicine with Dr. Moran. Today's video is on how to prepare for your doctor's appointment with a special emphasis on your blood pressure. Today I'm going to talk about how to get your blood pressure taken properly at home, how to record it, and how to present the figures to your physician. This goes a long way in helping your doctor and also involving you in your health care. My patients often ask me about how to make a diagnosis of high blood pressure or how to monitor it if they have it. They ask me how to best present the data that they acquire at home. They do understand the importance of high blood pressure. This, of course, can lead to stroke, heart attacks, kidney disease, and other medical problems. Blood pressure readings in a doctor's office can be much higher than at home, and they do not correlate particularly well with our gold standard test. The gold standard test is ambulatory 24-hour blood pressure monitoring. This gold standard I'm going to make a separate video on, but essentially it's a technique where one wears a blood pressure monitor for 24 hours and the blood pressure is checked on a regular basis about every 20 minutes during the day and 45 minutes during the night. We typically get 50 or 60 readings of the blood pressure during a 24-hour span, and it gives us a good idea of blood pressure control throughout the day. Now, home blood pressure readings correlate much better with the ambulatory monitor than readings from your doctor's office. In general, readings in the doctor's office tend to be 5 or 10 points higher than home readings. About 20 to 30% of patients will in fact have high blood pressure in the doctor's office, but when they're home, all of their home readings are actually completely normal. This phenomenon is well known to patients. It's called white coat hypertension or isolated office hypertension. Home blood pressure monitoring, though, can be very helpful in the diagnosis of high blood pressure. It's also helpful in patients who have established high blood pressure. Numerous trials have shown that home monitoring can improve compliance with medications as well as blood pressure control. Home blood pressure monitors should be checked initially when bought and then at least annually for accuracy. There's a couple of ways you can do that. One is to take your monitor to a pharmacy or to your family doctor's office and check the reading that you get with your machine up against their reading. They should be within 5 to 10 points of each other. The best machines are the ones that inflate themselves automatically, as opposed to ones that have to be self-inflated. Studies have shown that the blood pressure may go up even 10 millimeters of mercury if you have a machine that you have to self-inflate. Make sure when you buy a machine you get an appropriate size cuff. If someone is very obese, a wrist cuff can be used instead. Before taking your blood pressure, a number of things should occur. 30 minutes beforehand, do not eat, consume alcohol, consume caffeine, use tobacco, or exercise. All of those things will increase your blood pressure. You need to find a comfortable chair with a back. When you do sit down to measure your blood pressure, make sure you're sitting upright with uncrossed legs and your feet are flat on the ground. The arm that you're taking your blood pressure with should be well supported on a table with the palm up, just like I'm doing now. The cuff, when you put it on your arm, should be right at the level of your heart. Sit quietly for 5 minutes before you take your blood pressure. This is a picture of how you should be positioned to take a blood pressure. Notice the posture. This is important. Attach the blood pressure cuff to your arm 1 inch above your elbow crease, which is 1 inch from your funny bone being here. So the cuff should sit right here. When you put the cuff on your arm, make sure that this is where it overlaps within the acceptable range based on the markings of the cuff. Every blood pressure cuff has markings on it where the overlap point should be to ensure that you have the correct size cuff. Make sure if there is a marking for the brachial artery, which is here where I have my finger, that marking is in that spot. Once you're ready, turn the power button on and then press start. During the reading, make sure you sit quietly without distractions, and please do not talk. It is important that you record the readings properly. There are 2 blood pressure numbers to record. One is the systolic reading, which is the higher of the 2. This is the pressure when the heart is contracting. The other blood pressure reading is called the diastolic, which is the pressure in the artery when the heart is not contracting. There is a third number which you'll see on your machine, which is the pulse. Write down each of these 3 numbers. If your blood pressure seems high when you take it compared to what it is usually, it's always wise to take a second reading 3 to 5 minutes later. If this is much lower and more in line with your typical readings, then I generally recommend that you take a third reading and simply average the second and third readings and discard the first one. This is typically how we take blood pressure in our medical blood pressure studies. Patients actually take 3 readings, we discard the first and average the second 2. An important point is to make sure that your machine is reading correctly. Anytime you're not sure about it, you should always test the machine against the reading that you might get when your doctor takes it or at the pharmacy. As mentioned previously, the reading should be within 5 to 10 millimeters of mercury. You should know that home blood pressure readings can vary during the day. Often they can vary 10 to 20 points. Some patients will have a much higher variation. Remember that the blood pressure typically is highest in the mornings. Also note that anxiety, illness, or pain are reasons why the blood pressure will go up. It's a good idea at one point to actually check the blood pressure reading in the opposite arm. It should be within 10 millimeters of the arm that you usually take it in. Some patients can have an arterial blockage in one arm, and so that one arm's blood pressure reading can be less than the other. So if I have a blockage in my left arm, the number I get here might be 20 or 30 points lower than what I would get in my right arm. You always take the readings from the arm with the higher pressure. This will be more representative. Next is the blood pressure log. When you record your readings, this can be done on your blood pressure monitor or on an app in your phone, or a spreadsheet, as I will show in a minute. Or simply the usual way most patients do it when they come in to see me is simply a handwritten sheet of paper. It is though helpful to have one column for morning readings, one column for afternoon readings, and one column for the evening readings. This allows us to see whether there's variation in the blood pressure throughout the day and allows us to adjust the medications to provide much smoother blood pressure control. There's no point in having good blood pressure readings a half of the day and the other half of the day they're elevated. Remember that early morning readings tend to be the highest for most people because a number of hormones get released in the 4 a.m. to 7 a.m. time frame to get one's body ready for the day, such as epinephrine and cortisol. This tends to be where we see the most heart attacks and the highest blood pressure readings. Smoothing out any peak in the blood pressure reading at this time can be helpful. It is one of the reasons why I always recommend that if patients are taking 2 or more blood pressure pills, that you take 1 pill at night to prevent the early morning rise in blood pressure. It's always helpful when you're at home to take a number of readings, ideally 20, when one is trying to see whether you have high blood pressure or not. Alternatively, the ambulatory blood pressure monitor can be done, which again is our gold standard. It's also helpful to take home readings when there's a change in blood pressure medication or if the blood pressure has been found to be either too high or too low. Once the blood pressure comes under better control, less frequent readings are appropriate. Another key point to know is that if patients have dizziness when they stand up, it can be secondary to a drop in blood pressure with standing. I do have some of my patients document their blood pressure sitting and then again standing. Typically, we will take it 2 minutes after standing and 5 minutes after standing. The blood pressure should not drop more than 10 millimeters of mercury with standing. A significant drop with standing would prompt us to adjust your blood pressure medication. When looking at your readings, it's important to average the readings in each column, morning, afternoon, and evening, as well as to take an overall average. This is where a spreadsheet can be helpful so you do not have to do the math. As I mentioned, there are different ways to show the data. Your blood pressure monitor may be able to give you a 7-day, 14-day, or 28-day average. It may transfer the data to an app on your cell phone, or you may manually enter the blood pressure in a cell phone app. You can use a spreadsheet as I'm about to show, or what most of my patients do is the old school method where you simply create a chart with a pencil and a piece of paper and bring it in to the doctor. Here is an example of a spreadsheet. This contains a number of readings over a 1-week period broken down into the time of day, morning, afternoon, and evening. One can see the average for the systolic, diastolic, and pulse readings along the bottom here. The pulse readings can be very important, as I will explain on the next slide. Optimal readings. Home readings should be less than 130/80 on average. Ideally, it's nice to see readings in the 110 to 120/60 to 70 range. There's nothing wrong with readings of 100/60 as long as patients are not symptomatic with dizziness. Most premenopausal females will have readings of 85 or 90 systolic and 50 to 60 diastolic. Pulse rate should be above 55 beats per minute. Note that some blood pressure medications will reduce the pulse, and sometimes the pulse gets too slow and in fact can lead to dizziness. When the pulse gets too slow, the systolic blood pressure often goes up because the heart is simply running too slow. Medication adjustment in this case would be needed. If there is a significant discrepancy between your readings at home and your doctor's readings, an ambulatory blood pressure monitor is worthwhile. That way, this would be able to decide which of the two readings are in fact correct. If you have high blood pressure, there are many options for treatment. The most important ones and the ones that we always do first are lifestyle modifications. Many patients have lifestyle problems that lead to their blood pressure. There are many lifestyle things that people can do, but in general, a reduction in salt, an increase in exercise, weight loss, reduction in alcohol consumption, as well as reducing stimulant consumption like caffeine, improving sleep, and treatment of sleep apnea also will help improve blood pressure. There are some secondary medical problems which can cause high blood pressure, including thyroid disease and a number of others. These ultimately need to be ruled out by your doctor. Ultimately, if all of the above is not helpful, patients are started on blood pressure medications. If you are started on blood pressure medications, it's important that you know the name of the medicine, the dose, and the dose frequency. These are things that need to be written down on a piece of paper that goes in your wallet or purse. I hope you found the above helpful and educational. I try very hard to make my medical videos the most comprehensive based on best available medical evidence. This is Jag here. He has been wanting to hop up on the table the whole video. You've been watching Medicine with Dr. Moran. I'm Dr. Keith Moran. Get healthy. What do you say, Jag? Stay healthy.